We can jump right in. I only have 15 minutes to watch her live. Will you talk about this subject again? Yes, I do tend to go through different topics, different discussions. And so, yes, make sure you're following this page. Make sure you're following me. Make sure you turn on your notifications. And also, I would just shoot us this text message so that you guys can get in contact with my team, get in contact with our experts. Good morning. Do you really have to track all of your track to lose all your stuff? Oh, what do you mean? I'm not sure what your question is. Yeah, that's what I figured he meant, but I wasn't sure. Long term, I don't like people having to track calories, if that's what you refer to, because I don't think tracking calories long term is the most sustainable approach. What's people taking to help dizziness? There's no supplement or thing that I'm aware of to treat dizziness. Yeah, that's weird. I'd probably go talk to your doctors and see what might be going on as to what's triggering your dizziness. I started Saturday. Since then, I do 30 minutes of cardio in the gym. Is this even helpful or not enough? In fact, I don't even cardio is like the least important workout, guys. At the top of the echelon, like the top of the priority when it comes to working out, is always going to be resistance training. Resistance training is number one. Because you gotta build muscle mass. You gotta protect the muscle mass on your body. What we're talking about here is lasting weight loss, GLP-1 medications. We're answering questions, but then we're gonna get into a deeper topic about weight loss stalls, and weight loss plateaus. So we're gonna get into all of that. Hey, did you leave already? I'm thinking I should relog in. What do you think? 144. Are they hydrated? Hydration is good too. Yeah, hydration is important. We're actually doing a hydration challenge in our Mighty Network community, guys. Mighty Network is where my private community exists. Super cool. We have a ton of challenges. My ambassadors, the coaches, the courses, the guidance, everything is contained within that community. It's super awesome. Let's see, healthier lifestyle is the best way to go. It really is. Will GLP-1 stop affecting my hunger? It seems like many people end up developing some sort of resistance to the medication, especially when you're on larger doses. I don't know why that is. It's quite fascinating, but it does seem to happen. So, this is why we one of the many reasons why we stress staying on the lowest dose possible. Staying on the lowest dose possible of your GLP-1 is super important so that we can avoid these issues. Has anybody been throwing up since starting the GLP-1s? Yeah, a lot of people are vomiting, uncontrollably. A lot of people have poopy pants, and they can't stop pooping, diarrhea, constipation. You guys do not have to get wrecked by side effects. Like, it's crazy to me how many people are like, "I want the side effects," because they wanna know it's working, and that's sad. You don't have. I think we're good, the numbers are going up. You don't have to get wrecked by side effects. You need to have the right approach. The right approach is utilizing these medications as a tool and not the end all be all. Resistance training, we will teach you how to approach it, but honestly, resistance training, nothing's going to beat working with a personal trainer for a couple sessions at your local gym. If you just feel like you're like, "I don't even know where to start," working with a local trainer and then starting to watch a bunch of YouTube videos is the best way to become familiar with weight training. I'll teach you the lingo, I'll teach you the concepts, I'll teach you how to approach it. What's up, Mohammed? I'm not sure who Dr. Mike is. There's a Dr. Mike Israetel. That's not me, although good guy. Yes, these peptides come from us, user 999. So we are prescribing them. They come from a high quality 503A compounding pharmacy. Marley, I'm on week 2 of Wegovy and following a high protein, low carb, calorie deficient diet. So, yes, you wanna be in a calorie deficit. Yes, you wanna go low carb. These are really good things to do, especially at the beginning of your journey as you're becoming more insulin sensitive. And, we get people started with fasting and keto. Fasting and keto and weight training. Yeah, user 999, we have everything discounted. Just shoot us a text message. We're not we don't deal with research peptides. You're not going into a portal and ordering research peptides, and I hope you never do that. Um, no, it's cool. Mohammed, there's a Dr. Mike Israetel, who's another bald white dude with an Asian wife. He is another bald white dude who's fit with an Asian wife who also talks about I didn't realize me and him have so much in common. His wife is Chinese too. Yeah, she's Chinese. Oh, I swear to God, she's go look her up. She's thick though. She's muscular. She's definitely more of a power lifter type, but I didn't realize me and Mike have so much in common. I better hit him up. I better be like, "Hey, Doctor Mike, we both have Chinese wives." Yeah, no, I don't wanna offend anybody. He might not find that she might not find that funny. We're very sarcastic over here. JK, I was on 2.5 and I lost. User 999, are you oh, you're on my site to buy the retatrutide? Yeah, the coupon code is already there. Are you on our site where it says AOD, semaglutide, tirzepatide, and retatrutide? Yeah, the coupon code is already embedded into that. Guys, we do have retatrutide right now. 3 months is $900 and, for a 60 milligram bottle, and then for a 32 milligram bottle, it's, 1,400 or something like that, and that's with coaching. That's 503A retatrutide, guys. I would always recommend tirzepatide first. Always, always, always. We know more about tirzepatide. The only reason I really brought retatrutide was for people that are already struggling on Terz, and mostly because we're gonna lose access to tirzepatide pretty soon, as you guys know. Hey, do you wanna stop at the try to get the car registration? Yeah, I kinda wanna go. Yeah, we can go. We'll worry about it next week. That's fine. Um, there's a link in my bio, Danielle, but actually, the easiest way to reach out to us is right here, guys. If you guys are curious about our programs, our pricing, our coaching, how it all works together, this number right here is actually the best way to reach out to our team. Just shoot us a text message with your name and your email and ask to get scheduled for a free consultation with my team. They'll go over, the whole deal and how it all works. We talked about it. I would recommend tirzepatide first before retatrutide. Um, I was on 2.5 now, and I moved over to 5, and I'm not losing. Yeah, so JJ, uh, this is why we stress lifestyle. Carnivore, keto, lots of fasting, lifting heavy weights. Like, this is the inevitable solution long term, is you have to dial in your results. You have to dial in your lifestyle for long-term success. So guys, I'm gonna go ahead and start here in a couple minutes my discussion regarding weight loss stalls. I'm gonna break it up into 4 parts so that you guys can understand a more comprehensive overview. So if you just joined us, welcome, welcome. My name is Dr. Jones. Yes, there's peptides to repair labrum and BPC 157, TB 500. Shoot us a text message. You can get scheduled for a consultation for those peptides. Um, yes, tirzepatide is better. It's a dual agonist. It does hit both receptors, lower side effect profile, but we can make semaglutide work too as well. So in our clinic, guys, when you're working with us, you're working with our medical providers and you're working with me. We do service all 50 states, just so you know, if you guys see up here. And so if you guys have any questions, you're curious, you want to get scheduled for a consultation, then shoot us a text message right there. Okay, so and we do have a ton of free resources, just so you know. The Facebook group is awesome. The YouTube page, the podcast. Um, we have a lot of different resources available to help you guys learn and get it. Um, yes, paying for these medications, especially when they're not working, especially when you're not losing weight, is insane. And nobody has a solution for you guys long term. Well, stay tuned for this because you're going to learn now what exactly is going on. You're about to understand the science and how you all got here. So, okay, I know earlier we asked there was a lot of you guys that were currently stalled. So, actually, one more question uh, for the people that were stalled. Is this a situation where you were losing weight and you stopped, or did you just never really have weight loss to begin with? Let me know in the comments. Is it stalled results or no results? You never had results to begin with, or you were losing, you were happy, things were going great, and you stalled. I'm just curious. I just kind of want to get a better feel because right now we're going to talk about the stalled. You were losing, and then the weight loss stopped. Okay, so I figured it was a lot of stall. It was definitely a lot of stall. So the quick answer, Sloan, if you're interested in our affiliate program, just shoot us a message here, and they'll send you an invite. They'll send you an invite. Uh, the quick answer to why your weight loss stalled and slowed down and stopped is because you're not eating enough food. Now, how did this happen? Okay. Well, think back to when you started your GLP-1s, right? Like 1 year, 5 years ago, uh, and maybe like 1 to 2 years ago, right? Before starting your GLP-1s, how long were you guys suffering with food chatter? How long were you struggling with the hunger, the cravings, the binge eating, the food chatter? 5 years, 10 years, 20 years, your entire life? For how many years were you struggling to not eat when you wanted to not eat? This is a big deal. For many of you guys, it was several decades that you were struggling to be able to not eat when you wanted to not eat. And you wanted to not eat because you knew you were overweight. You were trying to do something. You were trying to implement self control. This is food chatter. This is the disease process. So then you take the medications, and it's like, holy shit. For the first time in your life, you can control your food chatter. For the first time in your life, you cannot eat when you want to not eat. This is like, this is insane, and enough people don't talk about this. This is why I'm without a doubt convinced that weight loss programs need to include GLP-1s, without a doubt. But but it's not the answer to everything because here we are. Now, you fast forward 6 months, 1 year into your medication, and you stall. You stop losing weight. You stopped losing weight because you didn't realize it, but you weren't eating enough food. How difficult do you think it is to eat enough food? How challenging is it for you to force yourself to eat when you're not hungry, when that's the very thing that you couldn't do for 30 years and now you've finally been able to do it? Think about that for a minute. Let that resonate in your mind and understand what a challenge this is going to be in front of you. I want to repeat that because I know that's kind of challenging to follow. For 20, 30 plus years, you couldn't control your body and not eat when you wanted to not eat. Now you cannot eat for the first time when you want to not eat. And now you have to do the opposite flow and force yourself to eat when you're not hungry. And that's such a mind trick. That's such a mind like flip, and it's confusing. It's very emotional. It feels wrong, right? I thought I wasn't supposed to do this. I thought I wasn't supposed to eat. It's a weird flow, if you know what I mean. Captain, technically speaking, retatrutide is not through phase 3 clinical trials. I'm very comfortable with it. I personally use it. We use lower doses with our patients, but personally, I would always go and recommend you the tirzepatide semaglutide path first before considering the retatrutide. So, okay, you guys get it. We're hammering this in. You understand the concept that I'm expressing here, which which is why and how you've got here where you're not eating enough food. Sloan, shoot us a message if you're curious and you want to get onboarded for the affiliate training program. It's pretty awesome. Um, no, Katie, they don't. They don't, and that's why I make the content that I do. That's why I teach the message that I do because people just don't. They just don't understand it. I'm gonna get into some more discussion here, guys. Let's see. We're gonna talk. Let's see. Yeah. So part one, how we ended up under eating. Now we're gonna start talking about part two of this series, which is the science of the weight loss goal, the science of the metabolic down regulation. Do our stomachs actually shrink when we are eating smaller meals? Yes, your stomach is very much responsive to a certain extent to how you're eating. I don't think they shrank to like a smaller size, no. But if you have expanded your stomach beyond normal limits, from what I understand, they do shrink back to normal size. So they're not going to shrink tiny sizes, but you can sort of have this feeling uh, where if you've been under eating for a while, yeah, it's kind of feels like that when you start eating more. Good morning, Dana. So, what's the science of the weight loss stall? Any ideas on where I can go to get lower costs or where I can go to get more advice? Melissa, I want to be like, hello, like this is us. This is what we do. So, you want more information? You got literally the best company to work with, which is my company, because we're going to set you up for success long term. We're going to make sure that you actually maintain your weight loss. We're going to coach you. We're going to guide you. We're going to make sure that you do this right. That's what this is all about. What are the supplements people should take? I'll go over supplements here in a bit. Basically, quick answer: magnesium, vitamin D, essential fatty acids, fish oil. Um, if you're on the GLP-1, obviously a probiotic and some digestive enzymes. These are really good. Good morning, Sammy. So we're about to start talking about part two of this four-part series this morning. Um, what is the science of the weight loss goal? Dana, if we do clinically think that a teenager needs help, then yes, we actually have surprisingly quite a few teenagers actually, and we have a couple YouTube videos where I've interviewed some of them, and they've done good. We get them fasting, we get them intermittent fasting, we get them adopting some lifestyle interventions. So, okay, let's talk about the science of the weight loss stall. So, to understand what's happening in the body, you have to understand the function of thyroid hormone. Uh, Dana, we're in a little a four-part series here, but the quick answer is the digestive enzymes, including the one I'm recommending has some bentane HCl, some pepsin HCl as well. So you're supporting the acidity in the stomach, and you're supporting the duodenum and the small intestine with broad spectrum digestive enzymes. And so that'll help with sulfur burps. That'll help you digest the food better. That'll help improve nutrition absorption. It's amazing. Even when you're not on GLP-1s, people freaking need um, digestive enzymes, and they need it even more when they're on GLP-1s, without a doubt. Okay, so thyroid hormone is responsible for stimulating your cells, activating your cells. And guys, you have trillions of cells in your body. And these cells, each of them have thousands of mitochondria. The mitochondria are like the batteries in your cell. And the mitochondria are responsible for producing the energy that you use. Food that you eat gets eventually shuttled into the cells and gets into the electron transport chain inside the inner membranes of the mitochondria. And they go on the electron transport chain and out comes energy, ATP. Well, when you have hypothyroidism or something's wrong with your thyroid, you don't have the thyroid hormone activating this process. And so you don't get as much ATP. This is why people with hypothyroidism, they can't lose weight. And the list of thyroid symptoms, difficulty losing weight, brain fog, tiredness, constipated, feeling cold, achy body, hair loss, brittle skin and nails, or oily skin, achy body, cold, somebody's already talked about. So these are thyroid symptoms. And quality of life is severely affected if you need thyroid hormone. This is why we include thyroid management, proper functional thyroid management in our program. If your doctor says your thyroid's fine, but you have these symptoms, your thyroid is not fine. Unfortunately, conventional medicine only checks for a TSH, and TSH is a good umbrella to catch a good chunk of the public, but a lot of people, their thyroid deficiencies will not show just with the TSH alone. So you got to do a free T3, a free T4, a reverse T3. You got to get this complete. You got to get this complete functional thyroid panel. The reason why I'm talking about thyroid, and yes, Amy, Graves' disease, an autoimmune disease that leads to hyperthyroid, is also an issue that we can help you out with. We have some powerful things for autoimmune disease. By the way, how many people watching this have an autoimmune disease or some sort of inflammatory condition? If you remind me, we can talk about inflammation after we go through these conversations here. Um, but if you have autoimmune disease, if you have inflammation, low dose naltrexone is my favorite support agent to help with the autoimmune driven inflammation. Yeah, Hashimoto's, Graves. So definitely stacking your low dose naltrexone with GLP-1 is super potent. And I don't know any other clinic that does that the way that we do. So if you guys want to get that autoimmune support and you want to lose weight, shoot us a text message right here, guys. Uh, very, very few clinics know about LDN, especially how to use it with GLP-1. Just so you guys know. Okay, so we're talking about thyroid because we're talking about weight loss stall. And the science of starvation mode, the science of why this happens after you start losing weight is you get this decreased thyroid hormone. Now, the difference is simple. When you're in a true starvation mode, survival mode, you don't need thyroid hormone. And this is why another cool thing about our comprehensive blood panel is that we can tell whether just by labs whether you need medication or whether you just need to eat more food. And I can tell just by talking to you 2 as well. So it's pretty cool that we have both the medical providers and me assessing this with our patients that work with us to identify the actual problem. If it's a starvation, which a lot of you guys, by the way, who said you were losing weight and you stopped, this is the situation. You just need to eat more food. And we're gonna talk about that in part 3. But you literally produce a a short-term hypothyroid situation, and now you guys have a better understanding of the science of it. You have a better understanding of, obviously, how it happened. And part 3 and part 4, we're gonna get into how to fix it. But I wanna take a little break in between, give you guys a chance to process all that. Does that make sense so far? Do you guys have any questions at all? And if you guys just joined us, welcome, welcome. So my name is Dr. Jones. I have clinics we service across the nation, all 50 states. I work with my medical providers. They prescribe and I coach the hormones, the peptides, the autoimmune support. Uh, we we have a very comprehensive approach to making sure that you guys minimize side effects, minimize complications, and maximize results long term. You don't need to be stuck on the medication for the rest of your life. Obesity is not an irreversible disease. Diabetes is not an irreversible disease. Bullshit. I will say that over and over and over. You guys have been told some pretty crappy information that's really messing with some of you, thinking, if some of you are in this boat, thinking that I'm gonna have to be stuck on this for the rest of my life, and you don't need to. You don't you don't need, in most cases, because I'll tell you this, the moment that you think and agree with the narrative is the moment that that actually becomes true. Um, it's, um it's pretty wild. It's pretty wild. Everything starts with a good mindset. Everything starts with your ability to make a decision and execute. Like, you make a plan and you execute. I'm gonna make changes. I'm gonna reverse my diabetes. I'm gonna handle my obesity. I'm tired of screwing around. I'm tired of looking and feeling like crap, you know? You gotta find that why. You absolutely have to find that why, because it's that why that's gonna really motivate you through the difficulties, that are gonna be in front of you. So, um, I really think that our coaching programs, guys, is are the best for people that are willing to do the work long term. And so this phone number right here, guys, is the best way to reach out to my team. So if you're in Ireland, if you're not in the US, you can still join my coaching programs, just so you know. And if you guys aren't ready for professional coaching, at least get into the community, guys. You need to get into the Flow Academy membership. It is freaking $27 a month, and I promise you the value that's there, what you're gonna get out of this is amazing. You get access to me, my ambassadors, the coaching, the different protocols, the courses, Flow University. This is a great option for if you just can't afford any sort of actual coaching. And it's also going to be your weight maintenance community. I'm struggling in getting my daily protein. So Greek yogurt, cottage cheese, eggs, um, Yeah, Greek yogurt, cottage cheese, and eggs, these are all, um, good sources. Whey protein powder if you can't get it. You can't get enough from food. What about the thyroid cancer side effects? So, very, very grossly over exaggerated. The cancer risks are very, very well, they're non-existent in humans. Um, Rodent models, specifically thyroid medullary carcinomas. So if you don't have a family history of thyroid medullary cancers, then you have nothing to worry about. What are some of the things that would disqualify you from GLP-1s? Family history of thyroid medullary cancers, active pancreatitis, active, biliary disease, gallstones, stomach paralysis, uh, and that's it. Those are the issues that would disqualify you. A Maverick taking BPC for 2 weeks now for wrist sprain. Just Amy, we got you covered for the accountability part. Are you in our community, Just Amy, or are you thinking about joining the coaching program? Let me know. So BPC, usually if you're on high quality 503A BPC, you should see some results within 3 weeks, but I don't know what dose you're on. I don't know if you're getting high quality. If you're getting peptides from a research company, guys, good luck. Research peptides are that's why they're research peptides. That's why you can get them online. They'll tell you it's high quality. They can tell you whatever the hell they wanna tell you. Heather, second week as a flow warrior. Whoop, whoop. You guys see what Heather said? Hold on, I gotta find what Heather said. Can we guys pin Heather's comment? Let's pin Heather's comment. Do you guys see what Heather said? If someone doesn't have a gallbladder, is it fine to start? It's going to depend on your individual case. It's going to depend. It's gonna be different from person to person. Guys, read what Heather just said. We figure out that she needs to eat more food. She starts eating more food and she starts losing weight. Mind blown emoji. Love that emoji, by the way. Good choice. Oh man. You know, um, the secret though is identifying whether or not that's going to happen. 'Cause some of you guys, if you just start eating more food, you might start gaining weight. So one of the perks of working with me as a warrior is I get to assess your starting point, have a conversation with you, and decide should you eat more or not. And I have a really good pulse on this, and it's one of the many things that working with me and working with my clinic provides is the proper guidance, the proper coaching. What sort of sorcery is this? Seriously, right? That's probably how she felt. But you know, we got this down. Um, I had thyroid nodules in the past, and I was turned down at one place, but 2 endos said it was fine and safe. Yeah, thyroid nodules don't necessarily mean it's an issue. What do those thyroid nodules mean? That's and it sounds like you got them assessed, they're non-cancerous. What about your family history? Uh, yeah, stomach paralysis is very slowed movement, sometimes completely stalled, which is obviously can be a really big issue. Maverick, you're in my program? That's awesome. Thinking about joining, was on Ozempic, but now on Mounjaro, no thyroid, and the endo can't fix it. Just Amy, not only can we fix your and get you rocking and rolling on weight loss, but we do thyroid management. Thyroid management is part of our program, guys. Thyroid management, autoimmune and inflammation management. That's why I love what we do because we're able to do all these things. We have multiple tools in the tool shed. What's a sample eating day? For me, it's meat. Last night I had a beef rib. I had beef brisket, and I and I had, some ribeye. And then after that, I had some, um what else did I have? What kind of fruit did I have last night? I'm trying to remember. Oranges, had a couple cuties, and, oh, we did have a little bit of strawberry banana strawberry banana ninja creamy, homemade ice cream. Is rash on the injection site normal? No, this is not normal. Hey, spiritual serendipity. We did fill the role. We are no longer hiring for advisors as we speak, but we are hiring, we're always bringing on affiliates and ambassadors. And so if you have any interest in that, shoot us a message. Good morning, Courtney. How are you guys? I see a lot of people just joined us here in the live. Welcome, welcome. So we're gonna continue on with this conversation about weight loss stalls. We're gonna continue on this conversation about fixing your weight loss stall. So get tuned, get ready. We went through the part one. We talked about why it happens. We went through the part two, the science of the weight loss stall. What up, Max? How you doing, buddy? Uh, Now you guys have a good background and a good understanding. So we're going to dive into exactly how to fix the weight loss stall. And so, do me a favor, introduce yourself. Hello, Heather. Where are you watching from, and what does your program look like? Are you getting results? Stall. Are you struggling? Do you have a good coaching program, or are you literally just winging it? Um, and I know most of you are freaking winging it. Most of you don't have a clue what to do, and how could you, right? Look, in case you guys didn't know this, the best people in the world at what they do almost always have coaches in their life. Having the right coach, having the right mentor, having structure, support, guidance, all the difference in anything you're trying to do. And guess what game we're playing here? This is the game of life. This is the game of health. Why wouldn't you want to be expertly guided and led down a path of health maintenance? Do you guys have faith and trust in the medical system? Are you guys comfortable with where the FDA and the medical association want to take you? Is that why you don't think you need coaching? Because the government and the powers that be, you know, is it like Allstate? We're in good hands. Is that what it is? I don't think we. This is not like Allstate. We're not in good hands. I've been on semaglutide for a year. I've lost 45 pounds, but no movement for 2 months. Frustrating. Well, I get it. That's super frustrating. We're gonna talk about. Yeah, Dana says hell to the no. Everybody else thinks we're in good hands. Okay. All right. Well, I can't do anything about that. Uh, Nina, we're gonna talk about how to fix your stall. Literally, you joined us at the best time ever during today's live. So stay tuned. Smash that like button, guys. Share this live out with anybody that you think would benefit. We do have a ton of free resources, and I want you guys to be aware of the various resources that we have. Um, I just got my blood test. Noah says for testosterone, I believe it's very low. What should it be for a 24 age? So you shouldn't be chasing a testosterone number, especially at 24. But let me tell you what your what symptoms you shouldn't have at 24 years old. Okay, if you have half or more of the same uh, symptoms, then you probably have suboptimal testosterone, brain fog, tiredness, lower motivation, lower confidence, increased anxiety, increased depression, less responsiveness to workouts, less sex drive. If it gets really, really low, you can have erectile dysfunction and just overall less confidence and vigor and push for life. That's what testosterone is, and so having half or more of those symptoms means you probably have suboptimal testosterone, and honestly, the 2 ways to fix it are testosterone therapy or carnivore diet. And I never in the world would have said carnivore diet as a solution to testosterone, but I think it might even work for some people. Do I think TRT is more effective? Of course, and I have a clinic that does testosterone therapy, but I don't the money is not why I do this. I do this for you guys. I don't make money off telling you to do carnivore. If you wanna try carnivore first, that'll probably help your hormones a lot. But some of you will still need TRT without a doubt. Some of you will definitely need carnivore diet or, the TRT without a doubt. And honestly, doing both is amazing. Carnivore diet reduces inflammation, promotes healing because you're removing the things that are damaging the body. Um, Shannon, I've lost 135 pounds. That's awesome, but you've been stalled for 4 months, and you're on the maxed out dose. MB, I mean, in theory, if you're using it correctly, you can take it whenever you want, right? But do you need to take it? And how do you take it correctly? Using the lowest doses possible is the best way to approach this. So, if you guys are curious how to reach us, how to get support, coaching, guidance, if you don't wanna be sick on Ozempic for 4 days after taking it, throwing up, puking, and pooping out of your pants uncontrollably, then you're gonna wanna work with us. You're gonna wanna get guidance, support. I can't think of a better way to go about this than to do this safely, correctly. Lower doses will fix the side effects. Al, I don't blame you. Sounds like it was an awful thing for you, but working with us, you won't have this issue. Working with us, you're not gonna have this issue. So, um, let's see, guys. I got about looking at the clock here, I got about, um, what's it, 6:34. Got about 5 more minutes, guys. 5-ish more minutes, and then I gotta go start my day here. Al, if you wanna work with us, shoot us a text message here. with your name and your email, get yourself scheduled for that consultation. I almost forgot though, I we gotta go over part 3. How do you fix the sorry, my bad. Let me do that first. I won't leave you guys hanging. So, how do you fix the weight loss goal? You do what's called reverse diet metabolic reset. So, this is where you slowly increase your intake of food, calories, nutritious food is always important. But you start at figuring out how many calories you're eating, right? This is what we do with you. And then we establish, yes, you need the reset. Let's say you've been eating 1,000 calories. Week number one, you're going to eat 1,200 calories. Anna, the carnivore is going great, by the way. So you start off week number one. If you were eating 1,000 calories, you start off at 1,200. Week number two, we're going to increase it to 1,400. Now, week number three, we're going to increase it to 1,600, and then 1,800, and then probably 2,000. Week by week, we're going to slowly increase your intake of food. We're going to pay attention to your body. How are you feeling? We're going to pay attention to the scale. The scale should not be increasing. Or in Heather's case, if she's still watching, she lost weight. So we should notice that you're coming out of zombie mode. We should notice that you're less tired, you're less brain foggy, you're less constipated, you have more energy, you're thinking more clear, you feel better, you're not as cold, right? So, Heather was a great example of how you could literally start losing weight. Although I told Heather, like, the goal is to not gain weight. And but about 25% of the time you'll actually start losing weight, which is really funny how that works, you know. So you do this up to the point where you basically start gaining a little bit of weight, kind of 1 or 2 weeks, and then that's where you know your ceiling is at. That's where you know what a full day's worth of food looks like. And then from there, you can do the flow protocol. And the flow is my structured approach towards permanent weight loss and permanent weight maintenance. Longer rounds of fasting every single week, followed by higher days of eating. So you can think of it as like an extreme weekly calorie cycling sort of approach. And you get all the benefits of long fasting. And we make it easier with the GLP ones. We make it easier with the peptides. Yeah, V Shred, I don't think he really knows what he's talking about. That's kind of why he's getting trashed in the community. Can you explain why you're not losing weight? Yeah, so, you came in on the end of today's live. We basically finished talking about the weight loss stall, the metabolic downregulation. Basically, you stopped eating as much food as your body needed, and your metabolism slowed down, and that's why you stalled. So, guys, if you want guidance, support, coaching, structure, shoot us a message here. We do have a ton of free resources if you're not ready to work with me professionally. We do service all 50 states. And if you are international, you can join my coaching program too as well. We just can't prescribe outside of America. So if you're sick and tired of being sick and tired and you want to do this right, reach out to us, get yourself scheduled for that free consultation, guys, and we'll see you later. Have a good day, guys. Remember, I do go live every single morning at 5:30 a.m. Mountain Standard Time, Monday through Friday. And then Saturday, Sunday, I go live at 7 a.m. Mountain Standard Time. We'll see you guys later. Bye.